Hi, my name's Dr. Rachel Corman. I'm one of the feline medicine specialists at Cat Specialist Services, and this video is to give you a little bit more information about insulin administration in diabetic patients. If your cat's receiving insulin, it's important that you know which insulin your cat is getting. The main ones that we tend to use will be an insulin called glargine, which can be provided in a cartridge, such as this one, or a pen, such as this one. Another glargine insulin called Toujeo, which is also available in a pen. So before you give your cat their insulin, it's really important that you double check which insulin you're meant to be providing by reading the label. Once insulin pens are used, they shouldn't be placed back into the fridge. Prior to opening them or using them for the first time, they absolutely can be stored in the refrigerator. But once they're being used, they need to be kept outside of the fridge, but below 30 degrees Celsius. Keeping them in the fridge after opening may affect the mechanism and the accurate dosing that pens such as these can provide. If you're using insulin in a cartridge, such as this one, it's important to make sure that you use the correct insulin needle. So insulin needles that we want to use are used at 100 units per mil. So you can see here it says U100 insulin. When we're using pens, it's important to take really good care of them to make sure that they can provide the accurate dosing, which is the main reason for using them. When we're using these pens, we need to use a new needle for every single dosage. The needles that we use here are 8mm long needles. You can get these as 4mm long needles, but sometimes these needles are too short to accurately deliver the appropriate dosage for cats under their skin. So, we take out our new needle and we peel the cap off. We uncap our pen. We've checked that we're using the correct insulin here. And we take the cap off. We then screw the insulin pen into the needle, like so. And you can feel that it's on nice and snug. We then remove the cap, and you can see that there's actually one cap here in the solid plastic, and there's another cap here. And we can see the sharp needle here, which is what will go underneath our cat's skin. We need to prime the pens each time prior to using them. And although this will use a little bit of your insulin, it's important to load the needle. So we dial up to 3 or 4 units here. Again, this is not to administer to your cat. It's merely to check and make sure that the needle is primed and ready to go. So we then push the purple button here. In the Toujeo pens, you can see the button is green. You push the button on the end and you can see that the insulin is dribbling out the end. So we know that that is a mechanism which is working to deliver the insulin. You can also note in the window here that the dosage has returned to 0. Next, we're going to select the appropriate insulin dosage for our cat. So let's say our cat is receiving 2 units of insulin here. So this is my model, Professor Moriarty, who's my cat. He's not actually diabetic, so we're not going to administer his insulin today. But just to give you an example, you can see that we can inject anywhere where your cat has lots of skin. And you can see that most cats have quite a bit of skin here over the back of the neck and on their sides. Okay, so just being nice and gentle. And we can pull this up and make a little bit of a sort of V shape here at the back. I've primed my needle, I've selected my dosage, I've got his little food snack ready to go. It's really important that we make this an enjoyable experience for our patients, so we're just giving him a little snack here. And then I'm picking up the skin here at the back of his neck. This one still has the cap on it just so that I don't accidentally inject him, so we remove the cap here. Push the needle in under the skin. So we're not going in perpendicularly, we're just coming in almost parallel to their back, and then we depress the plunger down here, and we try and hold the syringe and the needle in place for 5 seconds to give it plenty of time to empty all of the insulin out. Once we've finished, give him a nice pat, and insulin is done. Good boy. It's important to note as well that if you're unsure if you've delivered the appropriate insulin to your cat, make sure that you never give a second dosage. We're better off skipping a dosage rather than giving too much insulin and risking a hypoglycemic crisis or a low blood sugar in your cat. But if you have any concerns about administration, then please contact us or your local vets. So after you've administered your injection of insulin to your patient, disconnect the needle by gently unscrewing from the tip, and then we place that into our sharps container. Place the cap back onto the pen, and remember to store the pen somewhere cool but not in the fridge. It just needs to be kept somewhere under 30 degrees Celsius. If you're worried that you haven't administered the appropriate dosage, or that maybe the needle came out of the skin but you're not too sure, it's important not to administer a second dosage of insulin. It's much safer to skip a dosage of insulin rather than administer too much insulin and risk a low blood sugar level in your cat. However, if you have any concerns, please don't hesitate to reach out to your local vets, or also you can visit our website for further information about anything cat related. If you're administering insulin to your cat using one of the insulin cartridges and a syringe, the process is slightly different. You always need to make sure that you're using the appropriate syringes for your insulin. So this is a 100 unit insulin. So we're making sure that we use a 100 unit insulin syringe. Open the wrapper and remove your insulin syringe. We're just opening the wrapper of our insulin cartridge here. And the insulin molecules are very fragile molecules, so you never want to shake the cartridge. You just want to gently mix it like so. We remove the cap of our insulin syringe. We're checking the label of our insulin to make sure that we are giving the appropriate insulin. So this is a glargine insulin here. And then we inject the needle in through the soft grey hub of the cartridge, pull the plunger down, and you can see that the syringe is filling up with the insulin here. Now this is a 20 unit dosage, which is very, very high, and this is not the amount that our cat needs. But it's often easier to pull a little bit more of the insulin into the syringe. We're holding it upright to make sure that we don't get too much air entering into the syringe that may affect our dosage. And then we gently inject that insulin back into the bottle, and we're moving our dosage up to the 2-unit mark. So you can see the little lines on the insulin syringe here to the 2-unit mark here. And that's the dosage for our patient. So we remove it now from the bottle. Now it's time to inject your patient. Again, remember, it's important to have a positive reward so that this is a nice experience for them. Now, Moriarty here is not actually a diabetic cat. So I'm leaving the cap on my syringe so I don't accidentally inject him. But you'd be removing the cap for your patient. Next, we pull up the skin at the back of the neck here so that you've got some nice baggy skin under which to inject. And then we're just gradually introducing the needle into that floppy skin at the back. We're just coming in slightly parallel to his back and into that floppy bit of skin here at the back. And then we would just depress the plunger until it's all the way to the tip of the syringe here. And then we're done. Now remember, it's important to make sure, if you're not sure whether you've given the complete dosage, don't administer a second dosage. It's much safer to skip a dosage of insulin than to give too much insulin to your cat, as that would risk them having a very low blood sugar level, and that's much more dangerous than skipping a single insulin dosage. Remember, if you're unsure, please contact your local vets for further information, or you can always visit our website as well that has lots of information related to cats.